Well, landing at hospitals is a fairly routine procedure. However, with all facilities that we land at, of course, we need to make sure that they are safe, make sure that all of the proper safety equipment is in place, procedures are understood by all personnel. Because although this is a routine procedure, it is inherently dangerous, just like many other jobs that are out there, whether it be firefighting or other items of that nature. From our perspective, if we do not do things safely, we cannot provide the best service for the citizens of the community that we're trying to assist.
So here at St. Elizabeth East, you've already been out to look at the helipad there. How's the helipad look?
We have been out here a couple times looking at it, and from helipads that we have visited, this is probably one of the better installed and situated helipads that we've got to deal with here in the state. It is the first rooftop helipad here in Lafayette, so it brings a new experience both for us here locally as well as some of the other public service agencies that we have to deal with here in the city of Lafayette.
And since PHI started a base here out of the airport over Purdue, how often do you fly and how often is it utilized?
Well, actually, we started here in 2005, been based over at the Lafayette Airport since June of that year. We average approximately one flight per day. Now, the qualifying factors with that are, we of course are regulated by weather, or that does tend to hamper us sometimes, so that is a deciding factor. The flights that we do from here, the advantage that our corporation or our company has is that we are not basically tied that we have to go to any one facility. So from a medical standpoint, if you are severe trauma, we can take you to a trauma center. If you have cardiac issues, we can bring you to the cardiac issue. For an example, you're involved in a major accident out here on I-65, we can pick you up, get you to one of the local trauma centers, which would be either Indianapolis, Champaign, or Chicago. We do fly to all those different areas on a routine basis. The ship that's here in West Lafayette has been as far away as Toledo, Waukesha, Wisconsin, and Peoria, Illinois. So we do fly good distances. For cardiac services, one of the advantages that we can provide for the citizens that neighbor Lafayette is the fact that if you're in Monticello area or Jasper County or Crawfordsville area, and you do experience some sort of cardiac issues, we can pick you up from that location and bring you to this facility which does the cardiac cath procedures. And the idea that we look at, whether it be for cardiac or trauma, is they have a golden hour that we work with for muscle. If we can get you treatment within that golden hour, your chances of survival increase by 50 to 75% from whatever that issue might be.
And talk us through the approach today and what they're going to hopefully shoot for and how smooth the landing we're looking for.
Smooth the landing, well, that's one of those things. Any landing that is relatively smooth is a good landing. The things that we're looking at today is, since we have never landed at this particular pad, is they want to look at things from the air. There are some obstacles that were of concern to us, and we just want to get an idea of where those are in relationship to the actual approach patterns. Things they'll be looking at are from all four directions, because as we know, weather changes may come from any direction, so we may have to approach from any direction. So we've got to look at all the directions as we are doing that. Other things that we'll be looking at is some of the lighting system that they have set up here for us. How well is it visualized? And they also do have two different approach lights that we'll be aligning here today, probably later this afternoon, that will be used for approaches. The ship that we do have here in West Lafayette is only one of two what we call IFR ships here in the state. Most of the air medical helicopters, which are a total of 17 helicopters in the state of Indiana, fly under what we call visual flight rules. Those visual flight rules, we have to have a certain height that the clouds are for a minimum and a certain visibility distance that they have to use for flying. The particular ship that is over here in West Lafayette is an instrument flight rule ship, which means they can fly under lower visibility minimums. Now, having said that, that does not mean that we can fly in all weather. There are certain things, as an example this morning, the reason we delayed this morning was because the freezing levels were low enough that even with our aircraft, you just don't want to push the envelope and build up ice on the aircraft, because ice is very dangerous to us. This particular ship that we have in West Lafayette also is full autopilot capabilities. The nice thing about it is once we set in parameters into the GPS or the navigation system, the aircraft will basically fly itself so that we can attend to other duties that we're doing. Our basic aircraft crew consists of course, one pilot, one nurse, and one medic. Pilot experience runs 1,500 hours or greater, most of which are military experience. However, we have seen a higher influx of civilian-rated pilots coming into the industry now. The nurses and medics take a minimum of 5 years experience, most of which are from a critical care area, whether it be in a busy metropolitan area, whether it be ER or street. They have to be educated in multiple different areas. Both the medic and nurse are cross-trained in many areas. That way, in case one might have an issue with a procedure, the other would be able to assist with it and vice versa. The advantage of having the nurse paramedic crew is the nurse being familiar with hospital situations. As we fly to and from hospitals, they're being mostly familiar with those type of operations. They can take the lead in that role. As we do scene operations where we're actually landing on scenes of accidents or other things of that nature, then the medic would take the lead to help guide the treatment for the patient. So it makes up a very, very cohesive, coordinated crew.
So they're going to be coming from basically the west over the Purdue Airport.
Right.
And
now
that'd be the typical flight plan for this hospital?
Because we're based from that area, that is correct, but due to prevailing winds today, they'll probably be coming in from the northeast area. Now, the one difference that we do have with this pad that some of our other pads do not have is it does lie within what they call the Class D FAA control tower area. So there's a lot of extra communications that has to be done with them as well in coordination. One of the advantages that we have is because it does lie within that, they will help us giving us winds, our barometer settings, other things that we need to know to make those appropriate decisions as we come in for landing.
How big is the chopper, and plenty of room out there on that pad?
There's plenty of room out there. In fact, we're looking at it the other day, and depending on how they land or where the aircraft lands, with the size of pad that we've got here and the size of aircraft that we've got, we fly an EC-135, which is a Eurocopter helicopter. Here at this base, our other three bases use Bell 407s. From the size of this pad that is out here, we have determined that we can safely land 2 helicopters there. Now, granted, there are certain procedures that would have to be followed before we could do that, but we could safely land 2 in that particular space.